Namaskar friends, today we will see a very important condition, that is upward fixation of patella, that is also known as Shun, Saran or Chitki. So as you know that the stifle joint is composed of femorotibial joint and femoropatellar joint, and in this condition patella gets stuck over the medial trochlear ridge of the femur, and this condition is characterized by a stiff-legged gait, affected limb extended in caudally abducted position. So this condition results because of the laxity of the patellar ligament. Now, factors that leads to the laxity or loosening of the patellar ligaments are nutritional deficiency, exploitation activity, or occupational trauma. All these conditions may result into the laxity of the patellar ligament that results into the upward fixation of patella. So for treatment of this condition, you have to go for the medial patellar desmotomy, and for performing this method we are having two methods, open method and closed method. So for surgical procedure you have to restrain the animal in lateral recumbency, and then before starting the surgery you have to inject 5 ml local anesthetic solution around the medial patellar ligament on the medial side, and then you have to palpate the anterior tibial tuberosity, then medial condyle of the tibia, then you have to palpate very carefully the medial ligament, because there are three ligaments: anterior ligament, that is the middle ligament, lateral ligament and medial ligament. So in this procedure you have to cut the medial ligament. So in blind method you should not go for the exteriorization of the ligament. Just after palpating this ligament at the insertion on the tibial tuberosity, insertion point, you have to insert a number 11 BP blade to cut the medial patellar ligament. So you can see here we are inserting after identifying the medial patellar ligament, then you have to cut the medial patellar ligament. So after cutting you can easily feel the depression. So this closed method is preferable because there is little or no hemorrhage, no need to go for the suturing, and the healing will be rapid. In open method you have to go for the surgical exposure of the ligament, and then you have to cut the affected ligament. The affected ligament you can easily able to identify because it becomes very thick, hard and less elastic. So you can able to palpate. After cutting you have to pour the antiseptic, that is the betadine, and then in post-operative period you have to advise for painkiller and antibiotic in routine manner. So immediately after the performing the surgery you can able to see the animal is moving normally. So you should take care that you should not cut the middle.